Today we're diving into a story that could transform the future of weight loss and diabetes management, a pill that may one day mimic the health benefits of bariatric surgery. More than 37 million Americans live with type 2 diabetes, a chronic condition that affects the body's ability to regulate sugar. It's the 7th leading cause of death in the U.S. according to the CDC. Traditionally, type 2 diabetes is treated with lifestyle changes and medications, and in some cases bariatric surgery. A procedure that physically alters the digestive tract can provide remarkable improvements. But surgery isn't for everyone. It's expensive, carries risk, and only about 1% of patients who could benefit actually undergo the procedure each year. That's why one Hopkins gastroenterologist is working on a revolutionary alternative, a pill that could mimic bariatric surgery's effects. Dr. Ashish Namganekar of Johns Hopkins was inspired by a patient whose type 2 diabetes went into remission within 24 hours of bariatric surgery. That experience led him to a question: could the same benefits be achieved without surgery? The key lies in the duodenum, the first section of the small intestine. Dr. Namganekar calls it the master regulator of metabolism signals. In type 2 diabetes patients, this signaling is abnormal. Traditional surgery reroutes food to bypass the duodenum, but non-surgical alternatives like endoscopic barriers still carry risk. Enter GL200, a daily pill developed by Dr. Namganekar's biotech startup, Glycin Therapeutics. Now, this isn't just any pill. GL200 releases a temporary signal-blocking polymer along the duodenum, simulating the effects of bariatric surgery without the scalpel or incisions. It's designed to survive the stomach's acidity and activate only in the duodenum, creating the same beneficial signaling effect. Early human trials show promising results. Patients taking GL200 experience improvement in fasting and post-meal blood sugar, similar to the benefits of surgery, but without those side effects. The next step, larger, longer trials, up to 6,000 diabetic patients over a year or more. To scale this research, Dr. Namganekar is in talks with major pharmaceutical companies to license or acquire the pill. If successful, this could mark a turning point in how we treat diabetes and obesity, offering patients a non-invasive, more accessible option. So, could a pill really replace bariatric surgery? Well, time and clinical trials will tell, but one thing is clear: innovation in medicine continues to challenge what we thought was possible. Hey, think your bladder's sterile? Think again. Tomorrow on UroNurse, we're diving deep into the bladder biome, the surprising world of bacteria living inside your urinary tract. These tiny organisms can actually protect your bladder from infection or cause trouble when the balance is off. I'll be joined tomorrow by Todd Thompson, a registered nurse who's the real authority on this area, to unpack what science now says about the good, the bad, and the misunderstood microbes in your bladder and how they affect your urinary health. You won't want to miss tomorrow's episode of UroNurse at uronurse.com. I'm Vic Senese. Thanks for watching. Don't forget to like and subscribe. And for more stories next week, tune in.
UroNurse News, we've got the scoop.